We are going to go ahead and get started just for sake of time today. The biggest thing that we had, again, is introducing our BCBA core here. And we do want to be very explicit just with one disclaimer. While we are indeed behavior analysts, we are not your behavior analyst. And that's not to be opposing here. It's just a matter of we want to make sure that you're getting the care that you need with people that are in your treatment plan that know your child and can most service you. So just want to put that out there as far as if you're interested in any of the things that we happen to share. Our advocacy would be to go to an ABA practitioner, seek out a care manager that may be able to help you and connect you with the resources. Likewise, here at ABS Kids. We'll keep going on. Today, our goal is to have a couple different learning objectives here. We'd like to identify at least a few of the characteristics of autism just to kind of give us a baseline. Likewise, we're going to go over a few of the common challenging behaviors that we all may experience or understand that occur in the environments where we frequent. Last, we're going to be tying the functions of those behaviors in and trying to show maybe why these behaviors are occurring and help you guide what you're going to do in your next step. And last, we will also look at a few alternative options that we might be able to look at, de-escalation strategies, and of course a way of how we might be able to respond to go for a better result. Thank you, and we will get started with our PowerPoint here very briefly. First off, our learning objective getting into the characteristics of autism. We want to make sure that we can understand the 4 functions of challenging behavior. Likewise, I want to be able to identify common topographies. What do these look like? Last, I want to be able to prepare and better support that learner in these de-escalation processes. I'm going to have Molly come up first, and she's going to go ahead and talk to us a little bit more on the characteristics of autism, and we'll get this up on the screen for you.
Is it on that laptop?
Can you guys hear me? Is it too loud? Good? Okay. So we did have a graphic, and obviously it's not up right now, but I'll just chat a little bit about them. So the graphic just had the characteristics of autism as they're related to what the DSM-5 criteria is, which I'm sure all of you guys are very familiar with, just because your children have autism or someone else you know in your family does. So those, I'll just kind of go over them. The 2 main categories are difficulties with social communication and interaction, and then restrictive or repetitive behaviors and interest. And like I mentioned, we are aware that you guys are very familiar with these. You live with children with autism or know individuals with autism, and so you guys do have experience with these. We did want to touch on them because they do tie into why children may engage in challenging behaviors. So on one end, where there's difficulties with social communication and interaction, because children are not able to communicate their wants and needs, that may lead to them engaging in challenging behavior to get those needs met. And it's not bad behavior. They're not engaging in that behavior for bad reasons. It's because that's the way they know that they can do this, and this is how their needs have been met in the past. And then on the other end, for the restrictive or repetitive behaviors, an example of that could be difficulty with changes in routine. And when you have difficulty tolerating changes in routine, that could lead to challenging behaviors. And that's because they're uncomfortable, and that's the way they know how to cope with those situations. And so we did just want to touch on those main 2 points so that you guys could have more of an understanding of the why. It's not because they want to engage in bad behavior. It's because there's a communication there and they're needing to get their needs met. And so that's why we wanted to bring this up, to tie into some of the practical strategies that we're going to talk about today. So we're just going to get into the functions of behavior, and this kind of ties more into the why as well.
Okay, thank you for getting the slides up. That was perfect timing. I'm going to pretend like I know how to use this, and hopefully it works. Okay, so like Molly said, a lot of challenging behavior is tied to communication, and so we want to talk about the 4 functions of behavior or why those behaviors are happening. The first reason is that your learner may want attention. This could be because you're talking to somebody else or doing something else, like on your phone, or busy doing work or something like that. Another reason is what we call tangible, and that just means that your learner wants access to an item or activity. So maybe they want the phone to play games on, the iPad we see a lot, or different toys, maybe going to the park or something like that too. Another one of the functions of challenging behavior or all behavior is escape. And that just means that your learner wants to get out of something or they want a break. So maybe you're doing homework, you've been doing it for like 10 minutes, and they want a little break from that. Other thing is maybe that they're doing math homework and that's not what they want to do right now. They're not really into math, and so maybe they want to step away from it for a while, maybe do reading instead. The last of the 4 functions is automatic, and that just means that your learner wants to produce a specific feeling or get rid of an uncomfortable sensation. And I will give an example of that shortly. So going back to that attention function, one example of this is that you're goofing off with your learner, having a blast, and then somebody comes along and they're like, "Hi," and you're like, "Hi." And your learner notices now that your attention is on the guy with the soccer ball and not on them. And that might lead to them engaging in property destruction or something similar to get your attention back. Another function is tangible, so just going back to that, maybe something that your learner really likes is ice cream. They have their ice cream, they're super happy, and unfortunately, it falls, and that produces some crying, which is totally normal. I would do the same thing. And so it might just be that they lost their ice cream and now they want more ice cream to replace it. That escape function, one example of that is if a teacher goes up to a student and says, "Hi, it's time to do your homework." The student may flip over their desk. And that's because they wanted to get out of the homework or didn't want to do it. That last function that we were talking about is automatic. One possibility for that is that they're trying to produce a sensory feeling within them, and that would be like what is commonly referred to as stimming. Maybe they have different fidgets that they stim with. That's an automatic behavior. Another one is maybe you have an itch and you're scratching it to get rid of it. That's an automatic behavior.
Alrighty, and I'm going to go ahead and talk about some of our common challenging behaviors that we may experience. Right here I've listed 5. I'm sure several of you are familiar with these: tantrums, property destruction, throwing, aggression, and biting. Tying the functions to the replacement behaviors here, the most important piece for us is that behavior is communication. When we experience a behavior, they're trying to tell us something. They're trying to achieve some goal, whether that is tied to our function of access, attention, escape, or some sort of automaticity. In review of our ice cream falling over, we know that the communication here of crying is basically what? What are you trying to tell me right now? It's like, can I get someone from the audience here? What's the crying for the ice cream falling over mean? What are you telling me? I want more ice cream. That's what it is. That's exactly what it is. And we need to look at it as such. That is the communicative piece there. When we look at our friend that was throwing over his homework, we talk about this here. What was the function of his behavior? If he was trying to get out of this, what is he basically trying to tell me? It's hard, maybe. I don't want to do this. I'm tired of this. This is the 3rd, 4th, 5th worksheet that I've been working on. I'm ready to be done, right? Very good. Awesome. I appreciate your guys' participation there. As we go, we're going to continue our little practice here. What I would like for you guys to do is look at some of our different examples. We're going to come around, we're going to chat about this a little bit here, and we're going to ask maybe what the learner might be communicating with their behavior. Well, did I go too far? All right, here we go. Did I go too far? There we go. There we go. All right. First off, I guess, do we want to come up with a simulated model right now, or would we like to pull from the crowd? What do you think would be best for us here? Perfect. Let's go with that. What we're going to do is we're going to come around, we're going to ask for any examples maybe that we could speak on and maybe help you guys and come up with some solutions just for a brief period. We'll take about 5 to 7 minutes here to do that alongside you guys. Cool.
This big one.
Okay, now we're going to get into alternative options and how to support your learners in de-escalation. So this is going to be, again, a disclaimer that we are not your learners' BCBAs, and to contact their care team to include occupational therapists, speech therapists, psychologists, primary care physicians to make sure that we get you get input on this before intervening with any of these interventions. So the first one we're going to talk about is providing choices. So the teacher, or maybe you guys are doing homework, might say, let's do some work. And the child immediately flips their desk, like, heck no, I don't want to do any work. And an alternative option might be antecedently, so before presenting it, presenting two choices. So asking, do you want to do math or reading? Maybe they have a preference. Maybe math is really hard, but they like to read. The reason that we want to provide choices is it can help your learner feel empowered and help them feel in control and give them the ability to choose what they want to do when a lot of their life is out of their control. They get told a ton when they have to do things, how they have to do things, so giving them some of the control back can be really helpful. It also provides your child a chance to use communication skills to advocate for their needs. In whatever way that they communicate, whatever modality. And lastly, it can increase compliance or their willingness. Yes, go ahead. Yes, that is a perfect example of providing choices. And instead of asking the question, can you go set the table? No is communication. No is a full sentence. She said no. So giving her the option, okay, the expectation is that you have to set the table, but you could choose to do it now, or we can set a timer and you can do it in 5 minutes. And that gives her a little bit more control to feel like, okay, I can finish what I'm doing now instead of being interrupted. I can choose, I can get it over with, or I can do it in a couple minutes. Thank you so much for sharing. That's a really great example. The next de-escalation technique is validating feelings. So a lot of times our learners are feeling really big emotions and are having a really hard time communicating those emotions. And what we can do is validate them. Even if we don't agree with the behavior that they're engaging in, we can still validate the emotions because the feelings are valid even if the behavior is not. So we could say something like, I know that you really wanted to go play outside. I know you're really sad. It makes me sad when rain ruins my plans because we all get sad about things and it's the emotion that really, really counts. And when you do that and validate their emotions, you are creating a safe space for them to feel validated and feel like, yes, you're right, I do feel sad. And my caregiver, my care team sees that I feel sad and can acknowledge that emotion. It can also provide helpful supports with emotional regulation and building their self-esteem. So you're recognizing the emotion, and research indicates that when you name an emotion, it really helps you work through it. So you're modeling for them, naming the emotion even if they can't. You're naming it and you're taking away kind of like that big, hard like power of the emotion and saying, it's okay. It's okay that you feel sad. It's okay that you feel angry. I'm here with you to work through that. But the last part and the most important part of this is that it's not about giving in. So you can validate their emotions without saying like, okay, we can just go outside even though I set that boundary before. We're going to talk about boundaries in a little bit, but it's more about making sure they feel validated and not about giving in to whatever it is that they were asking for and were denied, for example. The third part is remaining neutral. So in this instance, the little boy is saying, like, he throws his math homework, maybe he says, like, this is too hard. So in that moment, we can remain neutral, which is really hard because we feel emotions too. And we can remain neutral and say, do you need help with that homework? Which is easier said than done. And maybe he says, yes, I do need help. But what could have happened is he could say, like, throw his homework and say, I'm not doing this. This is too hard. And we can be like, I have had it up to here. I am done with this. I can't handle this. And then we're adding fuel to their fire instead of modeling calm. We're modeling regulation ourselves and giving them a safe space to feel upset about whatever it is. And then maybe our little learner just runs away from us, and now they're not even in the room. They can't get any help with their homework because we had our emotions at the forefront, which again, we're human, so we're going to feel them, and it's going to be a practice, and it's going to be hard to be like, okay, I need to take a minute and I need to regulate myself, because if I'm not regulated, I can't regulate my learner. And then, Grant, this is you.
Thank you, Ty. And yes, this is where I can kind of tie in with holding boundaries. Holding boundaries in general, is just our set of rules, limitations, expectations, guidelines, and hopefully these are going to promote our desired behaviors that we want in an environment. A great example here is our dutiful librarian, giving us all a little bit of a reminder of the expectation when I'm in the library. We know that that's a quiet space, and the rules kind of, without even being said, we know to follow. I want to at least dispel that it's okay to set boundaries. It's okay to set yourself expectations and rules within the environments that you exist, whether that be in your home or out in the community. One of the most important features, and I just kind of did it here, as I said, look at your home or the community, and oftentimes this is going to be too broad. We want to do, just like we do if you're into practicing yoga like I am here, is you want to set that intention first. And a lot of times setting my intention, it's going to be about specificity. It's not just the home. Maybe it's the kitchen. It's a difficult environment for my learner. Maybe the learner has difficulty in the backyard. Likewise, when I get out into the community, I often as a parent may get to a point where I say I can't go anywhere. Well, what does that actually entail? What about, is it the grocery store? Is it maybe within the grocery store? Is it the toy aisle? What we want to make sure that we're doing when we set into these boundaries are more of an expectation of how we're going to get what we do want or what's being communicated to me in an effective and more appropriate manner. For us, we want to promote clear, concise, fair expectations that our learner can understand, that aren't too convoluted here, and are very focused on the behaviors that we want to see. Lastly, we're going to tie that always to a function of some sort. I will, before we get into the disclaimer, briefly just talk about boundaries and the basic functions that we have here. We looked at attention, access, escape, and automaticity. A lot of times when I'm setting a boundary for, let's say it's a matter of getting ice cream, an access item, I'm going to make sure that I'm setting up effectively how I can get this appropriately. We talked about our image there, and if our ice cream falling and crying is really not the mode that I would like for my learner to request more, we have to show or at least demonstrate and model what is the desired route. How does that look? If it's an attention component, how am I going to teach my learner to appropriately get that attention? It's not just a matter of, come up and grab me. I'm going to explore maybe some other options that I would like as a parent, or maybe even that's more acceptable in, again, the environments that we frequent. Of course, I say that here, and there's going to be times where certain environments are going to call for different behaviors. If we were all out last night, having a few refreshments, there's nothing wrong with me yelling at my friend across the room that I want his attention. But if I'm in a classroom, that's not going to really fly there, is it? I'm sure, several being on a college campus too, that's probably a more appropriate example than I anticipated. Our disclaimer here, though, again, just to kind of close out, is that all the suggestions that we've tried to give today, some of the advice and some of the role play and experience that we've shared, comes at a point of we want you to go and seek out ABA with a behavior analyst that's part of your treatment plan. If any of these things were to sound interesting to you or something that you would like to explore further with your learner or your family, we do highly encourage that you go to an ABA practitioner. There are several here in the Charlotte area. Likewise, it's an ever-expanding field, and they're constantly getting to newer and newer environments. All of that to say, we really appreciate your time today. Everything has been absolutely great. But we are going to close here with one last practice session. First off here, does anyone just kind of get into some questions, and we'll go back out into the field here as we go around with the microphones. But we would love to just look at maybe some of the things that you've learned, and maybe in particular with your learners' behavior. Have we tried using any of these techniques? Are there any that you feel more comfortable implementing over others? And lastly, is there any difficulty or are there items that you just find incredibly hard to implement? We'd be happy to answer those questions as we kind of close and end our lunch today, so we will come around, but we do, again, appreciate all of your attention and time. Awesome. We'll come around.